come to my practice, we're going to spend quite a bit of time finding out your history, what's been going on, what you'd like to achieve, what you'd like to accomplish. You may come in with irritable bowel, chronic sinusitis. I've helped a lot of patients with fertility issues. I work with attention deficit. I work with autoimmune diseases, just any number of things. And the important thing is, as a chiropractor, I focus on your nervous system. I do gentle adjustments. We use cold laser. We use ionic foot baths. We use intersegmental traction, just gentle massage tables. We use different electrical therapies, if you like. But the main part you're going to get is you're going to get an education. We're going to help find out what you need to do to get yourself well. I'll point you in the right direction. I'll be your health coach, but the healing comes from within you. I've never healed anybody, but I help a lot of people who have a lot of serious problems. I had a patient come in well, it's about 4 years ago now, and she had just come from the Mayo Clinic. She was there for over 10 days, and they did every test they could, every test imaginable on her. She had a constant shaking and trembling. It all started when she was 15 years old. She was going to school in Philadelphia, and she passed out on the stage. She did theater in the afternoon, classes all morning, theater in the afternoon. She loved it. And so they rushed to the emergency room, thought she was having epileptic seizures, and no, it wasn't epilepsy. And they did brain scans and CAT scans and blood work and tox screens and couldn't find anything. So they went from specialist to specialist, and this went on for 8 years. By this time, her skin was really bad. She had rashes, skin irritations, her colon irritation, respiratory problems, bright lights bother her eyes. She was allergic to so many different foods. She just was in terrible shape. So just coming from the Mayo Clinic, all they offered her was, well, here's a stronger drug to stop your hands from shaking. She had just graduated university, so this was a chronic condition she had. As she told me her story and I asked her a few very important questions, it was very obvious what her problem was. And I said, did any of these doctors ever mention this? And she said, no. And I said, wow, okay. So we started on her and started treatment. I started working on her, and I adjusted her, balanced her out, gave her a few supplements to take. She came back, she was going on a little trip. She came back 4 weeks later. She was 90% better. Virtually everything had almost cleared up. 2 months later, she was totally free of all the symptoms she came in with. And one of my patients, he's a plastic surgeon, and I asked him, you're a doctor, why didn't they get it? It was so simple and obvious. And what he told me, well, in medical school, we're trained to choose a symptom that matches the diagnosis, that matches a prescription to help it. Not what is the disease, or what's the cause, or how do I cure this, but how do we take care of the symptom? So medical doctors are amazing. We got the best, we got some of the best hospitals, the best equipment, the best machines, the best labs in the world. But they look at, if you ask a surgeon what to do, they can tell you surgery. If you ask a medical doctor will give you medicine because they're medical doctors. If you're in emergency situation, that's who you need to see. But if you want to get healthy, if you want to find out about health, you need to go to a health doctor. And that's what I try to help people with, to understand how to get healthy again, to return to normalcy. Your body knows how to fix you. It does it over and over again, every day of the week. We keep healing ourselves, correcting, repairing, rebuilding. That's what we're designed to do. And I help you get there.